Welcome to Spa Medica. We are delighted to show you around our new state-of-the-art eye hospital. You'll see lots of our COVID safety measures as we enter and have a look around the hospital. The health and well-being of our patients, staff and visitors is our greatest priority, and we are following all the latest guidance to keep everyone safe. And once confirmed everything is okay, we direct them to our reception to check in. At reception, everyone is greeted with a smile and offered our free refreshments, teas, coffees, water and biscuits. The patients begin their assessment in our visions room, where we check visual acuity to confirm the current visual level of the patient. The assessment room is where one of our nurses runs through some general health checks with our patients and talks through the process for surgery and answers any of their questions. The patients have their eyes examined by our hospital optometrist, who checks all the results of their eye tests and makes sure they are suitable for surgery. The optometrist discusses the benefits and risks associated with surgery and the likely outcome for the patient. They answer any questions the patient has, and if all okay, the patient is given a consent form to sign or take away and sign before surgery. Before seeing the optometrist, the patient will go into the diagnostics room and have their diagnostics done, which include K readings using the pentacam, along with corneal front and back surface mapping, lens star biometry, which calculates the power of the natural lens in the eye. This enables the calculation of the artificial lens, which will be used in surgery. OCT scans are taken if we need to scan the layers at the back of the eye. An A scan is only conducted if we need to assess and provide calculations where a dense cataract is present. The Optos is a wide field fundus camera and is used for all patients. The electron microscope is used for corneal cell counts if required. Our hospital also has multiple rooms for our optometrists and nurses and assessments, which allows us to hold multiple clinics for our patients, all socially distanced, of course. The first part of our patient journey on surgery day, we direct the patient to our reception to check in. Once confirmed everything is okay, we direct them to one of our nurses. Here's where we check the blood pressure, temperature, and check general health to check all okay for surgery or treatment. Consent forms are double checked, and the nurse marks an arrow above the eye and administers a small pellet to dilate the pupil. There are no injections needed for surgery. If any patients are anxious, we can provide them with a mild sedative to help relax them. The patient will then be shown into the ward to wait until their pupil is fully dilated. This takes about 30 to 40 minutes. Our patients often chat to each other in here, especially to share their previous SpaMedica surgery experiences, which helps put each other at ease. Once the pupil is dilated, the patient is shown into our pre-theatre check room. Surgical hat and foot covers are put on. The small pellet tablet is removed from the eye, and the surgeon comes to talk through the procedure with the patient, checking all is okay and answering all their questions before proceeding. In theatre, there'll be the consultant surgeon along with 3 or 4 of our theatre team. This is a relaxed environment, and the patient will be helped onto the bed and then reclined. The surgery lasts about 5 to 10 minutes, and patients often comment how quick it is. Further anaesthetic and antibiotic drops are applied into the eye following surgery. The patient is guided from the theatre room to our discharge room. One of our nurses will check they're all okay and talk through all the post-op steps and answer any questions they may have. The patient is given a post-op bag with drops, post-op guidance booklet, and information about their post-op assessment. We also let the patient know about our 24-hour Spa Medica helpline if they need to call us in an emergency or if they're having any issues when they get back home. We hope this tour has given you a good idea of our hospital and the layout. This has been designed to be a modern, high-quality facility where we can welcome thousands of patients from across the region to help improve their vision. Together, we're making a difference.